Okay, good morning. I'm Paul Troxel, 911 Branch Manager, 988 System Director. Welcome, Lon. Thank you. With all the construction and traffic, it's hard to predict. Yeah. So it is 10:23, and council confirming go through and reconduct roll call. Okay, we're going to go ahead and reconduct roll call to confirm quorum in facility. Dr. Bowie.
Present.
Dr. Raflayan?
I'm here.
Joe Sullivan? Terry Galvan?
Here.
Julian Aragon?
Present.
Lon Nguyen?
Here.
Thank you. Glad you made it safe. Kristen Miller? Ametria Sidney?
Present.
Jeff Hebert?
Here.
Tracy Gonzalez? Jennifer Kenton?
Present.
Aaron Riley? Jamila Fields?
Here.
Serena Lewis? That confirms we have 8 board members present. That meets quorum. We can begin the meeting. Okay. The first item on our agenda is the approval of the February 2025 meeting minutes. The meeting minutes were distributed to the board members prior to the meeting. Do I have any corrections or additions to the February meeting minutes? Do I have a motion to approve the meeting minutes?
Move to approve meeting minutes.
Do I have a second?
I'll second.
Okay. We'll conduct a roll call vote. Dr. Bowie?
Yes.
Dr. Raflayan?
Approve.
Joe Sullivan?
Approve.
Terry Galvan?
Approve.
Julian Aragon?
Approve.
Lon Nguyen?
Approve.
Kristen Miller? Ametria Sidney?
Approved.
Jeff Hebert?
Approve.
Tracy Gonzalez? Jennifer Kenton?
Approve.
Aaron Riley? Jamila Fields?
Approve.
Serena Lewis? Unanimous vote. The meeting minutes are approved, and we'll get those posted up on our website for the February 2025 meeting. Next item on our agenda is the legislative update. The Cal OES Legislative Affairs will provide information regarding recent state and federal legislative actions influencing California's 911 and 988 systems. I believe we have Mr. McGinnis. Thank you. Mr. McGinnis, please proceed with your briefing.
Thank you, Paul. So good morning. My name is Paul McGinnis, Legislative Coordinator here at Cal OES. I'm going to briefly run through a few key upcoming legislative dates as well as bills that we're tracking and looking at now that may be relevant or of interest to the board. So a few key dates. May 23rd, which is next Friday, is the last day for fiscal committees to meet and pass bills in the first house. And June 6th is the last day for the first house to pass bills to the other house. Looking forward, September 12th is the last day for the legislature to pass all bills, and October 12th is the last day for the governor to take action on all bills put on his desk. So I'm now going to run through a few bills that we've identified. It's 7 state bills and 4 federal. And I will make this list and the summaries available to the board through Samantha after the meeting. So first bill is AB 330. This one's an amendment to the Local Prepaid Mobile Telephony Services Collection Act. And it pushes the sunset for the surcharge from 2026 to 2031. That bill is on appropriations. AB 470. This bill would provide specified procedures for telephone corporations to be granted relief from their carrier of last resort obligations through specified CPUC approval process. That bill is also on appropriations. AB 645. This bill would require EMSA by January 1st, 2027 to develop and adopt minimum standards for emergency medical dispatcher training. The bill would require a public safety dispatcher or public safety telecommunicator, as defined in the bill, to complete that training. This bill is also in the Appropriations Committee. Next is AB 654. This one would require the County of Los Angeles to establish a homelessness resource telephone system to receive calls regarding individuals who are experiencing or at the risk of experiencing homelessness. And this bill is also on the Appropriations Committee. AB 727 would, commencing July 1st, 2026, require public and charter schools grades 7 through 12 and public or private higher education that issue ID cards to have the Trevor Project's 24 hours per day, 7 days per week suicide hotline printed on those cards. And a note on that bill's existing law requires the 988 suicide and crisis lifeline hotline to be printed on those cards by July 2025. That bill's on the appropriation suspense file. Just a couple more state bills. AB 911. This bill would exempt bucket trucks and cell on wheels units owned or purchased by emergency telecommunications service providers from specified ARB requirements in the Advanced Clean Fleets regulations. The bill is on the appropriation suspense file currently as well. And the last state bill is SB 465. As currently written, the bill would establish a statewide emergency alert system called California Alerts. The system would utilize the wireless emergency alerts, or WEA system. It requires also Cal OES to contract with a private vendor to build out the inventory of non-location based phone numbers and to establish standards for issuing the emergency alerts to California residents across local jurisdictions. That bill is also on appropriation suspense. Excuse me. So I'll now run briefly through four federal bills we've identified. First being HR 540, which is the 911 Saves Act of 2025. The bill would require the Director of the Office of Management and Budget to review and make certain revisions to the standard occupational classification system. Last action on that bill is January 16th. Next is HR 2937, the Protect 911 Act. This bill would require the Secretary of HHS to improve the detection, prevention, and treatment of mental health issues among public safety telecommunicators. Last action on that bill was April 17th. Next is S290. This one would direct the Secretary of Interior to upgrade existing emergency communication centers in units of the National Park System to Next Gen 911, as well as for other purposes. Last action, January 29th. And the last bill I'd like to share today is S666, the First Responders Wellness Act. This would increase access to mental health, substance abuse, and counseling services for first responders and for other purposes. And that last action on that bill is February 20th. So that concludes the legislative update, and I'm happy to take any questions the board might have.
Thank you, Mr. McInnes. Do we have any questions from the board members?
I have a question. For AB 645, with our centers dispatching mobile units, would there be any overlap with 988 centers for mandatory training?
It doesn't specify in the bill right now that there would be overlap for 988. But I can take a closer look and get back to you on that to make
Thank
sure
you.
that's the case. Yeah.
Any other questions from the board?
Sorry, I do have a question. For, I believe it's AB 727 for the student ID cards.
Yeah.
My son's school, for example, they issue digital ID cards, so I'm not sure if the intent is to have the number physically with you and stuff, but I'm not sure it will work necessarily with the digital cards as far as having it highly visible. Anyways,
Yeah.
maybe there's someplace else we can put it.
It's a point well taken. We can make a note on that one for the bills that we're tracking here. So thanks for that comment.
Yes.
Yeah, just a comment. I'm surprised that 988 hasn't been already on the student ID card, because we know for a long time now, 5-6 years or even longer, that student with middle school up to high school, they already had what we used to have, the National Suicide Prevention Lifeline number on the back of ID card. And since 988 has become law in July 2022, we would think that they would just, instead of the 10 digits of National Lifeline, they just have 988. But if they don't already have that, that's surprising. They should have.
They should.
Yeah.
They should have it. They're statutorily required by July 1st of this year, so less than 2 months. Otherwise, they'd be out of compliance.
Paul, just for clarification, so it takes effect July 1st? This new,
It
this
does, that's
requirement?
existing law.
Okay, so that's
Yeah.
existing law. Okay, thank you.
Yep.
To further clarify, this is an enhancement to existing law, or is this a new?
Yeah, it would add another hotline, the Trevor Project hotline, in addition to 988, to be
Okay.
put on the student ID cards.
Okay, perfect. Thank you. Thank you for that clarification. Okay. Any other questions from the board? Any questions from the public? All right. Thank you, Mr. McGinnis. Appreciate your support.
I have a question. I'm a member of the public online. It's Sherry Sinwelski with D.D. Hirsch Mental Health Services. Is it okay for me to ask the question now?
Yes.
Yes.
Great. I'm not sure if this is appropriate for this part of the agenda, so if we need to table it, it's fine. But I just had heard that Governor Newsom was supposed to be making a statewide funding announcement today that included additional funding for the 988 centers. And I was curious if anyone here is aware of that or has any more information on that.
This is Lisa Mongan. I'm Chief Deputy Director of Cal OES. I think what you're referring to is the governor's May revision, which was released yesterday and made public yesterday. Is there someone from HHS here that will be speaking to that later on?
Dr. Bowie is online, and she's the board member.
Okay. Dr. Bowie, can I confirm that you'll be discussing that a bit later on in the agenda?
Yes. Awesome. Thank you.
All right, thanks.
All right, thank you. Our next item on the agenda is our working group reports. The 988 Technical Advisory Board working groups will provide a report out on activities completed since the last meeting. Our first working group is the 988 and 911 Interface Working Group. Jeff Faber.
Thank you, Paul. So as many of you know, we had an interface working group meeting on April 24th. It was structured differently than what we've done in the past, where it was a public meeting held here in this room. I think we had one, other than myself, one other, and the Cal OES staff, one other person in attendance in person. The rest were online, but we had probably almost 30 participants online. We received a presentation from, and I can't think of his name.
San Ramon.
Yeah, San Ramon Fire from Preston. Do you know?
I believe it is.
Okay. Talking about what San Ramon has been doing and the successes they're seeing there with transferring behavioral health and mental health calls to avoid unnecessary response from law enforcement. It's also structured as a co-response between fire and medical and behavioral health response. It was insightful information that we're going to continue to look at. He's going to be providing some more information that we can use to inform and instruct our further revision of the guidance document that we have. There was some discussion from the participants as far as the things that various individuals believe need to be incorporated into the document and where the direction of the document needs to go. There will be another interface working group meeting sometime probably in mid to late June. It will be structured very similarly. I would encourage those who have specific feedback either to attend that meeting if possible to provide that feedback, or reach out to me separately to provide that feedback, because from that meeting we're going to restructure the document, hopefully with the purpose of being able to present it to this board for a consideration for a vote at the next meeting that we have.
All right. Thank you very much. I appreciate the hard work that you and the working group have been taking on with that effort. All right. The next working group is the Accessibility and Equal Access Working Group. Dr. Bowie, will you be providing the update?
Dr. Bowie, you're muted, unfortunately.
Sorry about that. Yes, I will present some part of it, and with help from Dr. Rafla Yuan. So we will do a relay. So the Accessibility and Equitable Access Working Group did meet on May 7th. We are recruiting more members and getting a few more members due to some personal and professional life changes. We lost a few members, and it is actually a good time to reconfigure and get more members as we move into more implementation phase of AB 98 implementation. We are asking if the Technical Advisory Board would consider assigning us particular deliverables that are related to access and equity in the work. For example, reviewing the equity section of the AB 98 implementation plan and make recommendations that are related to technology that this board could address. One example may be reviewing language access standards as laid out by SAMHSA and compare it to the work that Cal HHS and state departments have recently done in updating the state language access standards, and then maybe even looking at language access standards at Cal OES and other 911 system partners to see if there are opportunities for alignment and adaptation to the 988 technology access. These are just some examples, but one specific ask that the working group does have is to have some tasks to do over the next year or so. I think that's kind of the general gist. There are some specific recommendations that we would like to present to the board for consideration. And for that, let me hand it over to Dr. Rafla Yuan.
Thank you, Dr. Bowie. So I have two items that I wanted to bring forward from the working group. One is a recommendation of a feedback mechanism of some kind. We don't have a specific recommendation on how that should be accomplished, but we do note that there's currently no ability for any service user, like a help seeker, to provide any kind of feedback, including on technical quality control issues, such as if a certain area was not having good reception or if certain languages were difficult to access. We have gotten sort of case-by-case reports that these things have been happening, especially with language access for languages other than English. Or the sign language or the deaf services. But there's no way at this point for the help seeker to provide any type of feedback to any state entity in California. The one route that currently exists nationally is through Vibrant, which is chartered, or I don't know if chartered is the right word, but falls under the laws of New York. And so that wouldn't necessarily come to a California entity. So that was one recommendation. And then the second recommendation is we've recognized that there's a need to help educate both the general public as well as other 988, 911 stakeholders on the general flow of 988, which is very different from 911, where calls to 911 are generally expected to result in some sort of dispatch, whereas that is inverted in 988, where calls to 988 are not expected to result in any type of in-person dispatch. And in fact, more than 95%, at times up to 98%, are resolved fully on the phone. And so this is a sort of like a paradigm shift, a culture shift that we have noticed hasn't yet crossed into the general public, as well as other 911, 988 stakeholders who perhaps are under the perception that 988 is a, quote, 911 for mental health, and then sort of expect that a large percentage or perhaps a majority of help seekers who reach out to 988 are connected to an in-person response, when that's not the case. And so we were thinking about an infographic or some type of information to publicly help educate stakeholders and help seekers about this.
I have a question on that, if I could. So Dr. Raflian, has there been discussion related to that when you talk about that paradigm shift and looking at 988 as not being like a response type initiated phone call or generating phone call? What about those areas that heavily are supported heavily by like mobile crisis response teams and the integration for that? Because I think, at least in my region, I know there is that expectation, not the expectation, I guess, but the because mobile crisis response is very heavily supported by local governments, and that's kind of the attitude towards if somebody needs mental health support, that the MCRT is available to them. How would that work in those discussions, or is that just really just based on up to the 988 center that receives the call, making the determination if that would be the best resource?
Yeah, so I think what you're talking about kind of exactly describes some of the need for this type of education or this type of informational awareness. So there's a perception out there, if I contact 988, there's a significant chance that an in-person response of some kind will show up. But that's kind of predicated based on how people utilize 911. But 988, the large majority, like 95, 98% are fully resolved over the phone. So there is no mobile crisis intervention. There is no law enforcement intervention. And so that initial piece, just that the large majority of calls, and this can help people have an informed understanding of how 988 works and help them decide what is the appropriate service to utilize. And so in terms of how the actual dispatch works in terms of what those 2% are that then are dispatched to an in-person response. So that's dependent on the work that you all are doing in the 911, 988 interoperability working group, as well as the local governments and how they decide to triage this, their center variability. So we're not specifically talking about that. We're talking about before it even gets to that, where it might need to be transferred, just the general idea that the large percentage, large majority of calls are fully resolved over the phone, which is very different than how 911 tends to work.
That makes sense. Thank you. I appreciate that. Also, if I could ask a generalized question to anybody who might be on, maybe Lon, you could weigh in on this. For the 988 centers, right now, how are you handling callers with the speaking languages other than English? Are you using translation service if you don't have an in-house bilingual?
Yes. I mean, most crisis centers have very diverse group of staff and volunteers. However, I mean, it's a 24/7 operation, right, and those staff volunteers are always there to answer those language needs. So we use translation services.
So that'll be something we haven't, so Dr. Bowie, based on your comments, it made me think about it, something we're going to have to, in my working group, address. Right now, a PSAP can get a 911 call. They might have to engage a third-party translation service if they're speaking something other than English. And now if we identify it, it qualifies for a transfer. The impact of now, do I keep that translator on while that transfer occurs, or does that, we rely on? I think it's just an unanswered question we just haven't addressed that we're going to have to address because of that. So thank you, I appreciate that. Thank you, Paul.
Thank you. If we can make a note, we can talk with our engineering team and NGA who's building the state's platform to see if that's been taken into consideration. I believe it has, but we can confirm.
Yeah, it has happened before when actually we had callers that request to speak in our language, and then when we determined that this caller will need support from 911, yeah, that we request translator to stay on unless the dispatcher determined that this is not necessary. Yeah.
Yeah, that would be the cleanest. It's
Yeah,
just
the
something
cleanest,
I think
yeah.
that would have to be considered because everybody's going to be structured a little, or potentially structured a little differently.
Yeah.
Right. Thank you. Good questions. Okay. Any other questions from the board? Any questions from the public?
There is one more item in terms of recommendation from the working group. May I mention that?
Yes, ma'am. Please go ahead.
Okay, great. I think one more issue that was brought up is the data ownership question. So given that there's a fair bit of concern about from the communities about data being collected by a government program, we're wondering if there's a way for Cal OES, a technical advisory board, to think about putting in writing what is the state's viewpoint. And this has been said verbally before in terms of data ownership from a state platform level, that the state collects only aggregated, de-identified data for quality improvement and access, reviews, things like that, and that the ownership of the PHI belongs to the 988 centers. I think that's something that had been said verbally, but I don't know that we've ever captured any of these data ownership issues in writing. One caveat to bring up is that this data ownership issue has been brought up to our federal partners before several times, and SAMHSA was working on getting a draft data use agreement framework to the states and territories for review, but they are kind of behind on some of those things at the moment.
Thank you, Dr. Bowie. I've taken a note, and I'll discuss internally with my leadership and my team, and we'll come up with a way that we can provide an answer to that.
And Dr. Bowie, maybe it's a pull-out separate conversation kind of between the state agencies on the Health and Human Services side and the Cal OES side, kind of like, how is the data going to be used? How do we communicate that, and who owns the data, et cetera, et cetera. There's definitely a way to do that.
Yeah, I think it's also a conversation that had been had fairly free with the 9/8 centers as well. Thank you.
Okay. Do we have a question online? All right, we have a question online.
Hi, there's a couple questions online. I look like I'm the first one in the queue. Matt Taylor from D.D. Hirsch. I just wanted to sort of remind the group about the language translation services that are available. Lon mentioned that his center uses translation services. And in fact, all 988 centers in California, as well as across the nation, have access to immediately plug in live translation services in over 250 languages. No 988 centers pay for that. that the cost of those interpretation services are actually covered at present and always have been covered by the national administrator of 988, which is Vibrant Emotional Health. So again, those language services are available right now at no cost to any of the existing 988 centers. Thank you.
Thank you, Matt. There's another comment online.
Thank you. Nargis Dillon here from Crisis Support Services of Alameda County and the Crisis Center Consortium. I did want to echo Dr. Bowie's concern regarding or point regarding data ownership. This is something that comes up a lot from our callers. And I think as we move towards a unified platform and a unified data storage, this question has come back up. So having both a center facing or kind of a public two documents I think are needed. One that is like logistics for us and another that can be public facing that could help build that trust with the communities that use our services. Thank you.
Thank you. Yeah, I'm definitely taking that as a note as we discuss this data ownership. Any other questions, comments online? Okay, for the technical advice.
One more question. I'm sorry. Is this the point of the agenda right here where new work groups are recommended? I think I saw that under agenda item 4C.
Yeah, I was just getting ready to jump into that.
Perfect. Thank you.
So for the technical advisory board, are there any other working groups that are needed to support the technology discussion in 988? Yes, sir.
Yeah, so Santa County is 988 Center is part of the larger California 988 Crisis Center Consortium. And there are 12 988 centers serve various regions throughout the state. And at the meeting from time to time, we hear the concerns and the needs to have a working group that represent an 988 center working with the members of the advisory board, with this advisory board, because we believe that each of the 988 center has its own unique set of needs and challenges. And they would like the board to be more informed about those needs and challenges, and just to know more about the work that we do here. Because whatever initiative or decision policy that we come up with, they don't want to be impacted. So they would like to have that direct relationship with the board through that working group. So that's a desire that they would like to have, and I strongly support that. That maybe either some members of this advisory board or the representative from CalES and NGA and so on to have that working group with them on a consistently basis so that issues can be resolved, questions can be answered and can be addressed and so on in a timely manner. So when it comes to the board, we'll be very informed with the work that they do, the issues that they face, and so on. And that's a request, and I support that.
Okay. I believe the way our board is comprised, if we have a working group, we need a board member to sponsor that working group and be the point of contact. Are you volunteering to be the point of contact and lead that working group?
I'm happy to do that if the board feel that I'm the best person to be in that role. I'm happy to do that. Yeah.
Is there any further discussion on that? The working group working with the 988 consortium?
I believe Terry has comments. Yeah.
I would just like to add that a core function of that particular working group will be to guide the implementation of the platform. We want to have space to use the same design that you're using work groups for other elements to specifically have that structure around implementation. And like Lon, I'm also happy to lead. So if you have two board members who are able to lead that work group.
Yeah. I believe the way we've structured the other working groups, we have two board members representing each of the working groups. So we have a primary and a secondary, so we can conduct, we can always have a point of contact. for council, is this something that we need to just assign, or do we need to take a vote of the board? Okay. Okay. So what I've heard of, I have two volunteers. Jeff, you have a comment?
No, I'm not volunteering, but he almost walked me right into that. Lon, could you clarify? I mean, I like the idea, but what would be the purpose just for that consortium, which already meets and discusses? You're part of it, I'm
Yeah,
assuming, right?
yes. Oh, yes, yeah.
And other board members are. What would the working group be doing for this board? Like what kind of product, other than just being able to provide a voice, which it sounds like they already have. And again, it's not because I'm against it. It's just I want clarity on what we're asking the working group to do.
So I think that the specific initiative that the board, created or come up with, or some of the technology that's going to be used for 988, like the unified platform or text and chat and all that stuff. And those are some of the initiatives that the board's going to be approving and acting upon. Things that are specific like that, but they are also all the general things that they would like to hear, for the board to be informed and hear directly from them, and then come back and report back to the board, just like I think 988 and 911 interface working group.
Okay, thank you.
Okay. So just to confirm, we have volunteers to support this 988 Center working group between Lon and Terry.
Could be either one of us.
Yeah.
Well, we can be the 1 and 2, yes.
Yeah, okay. So if you can come up with a list of members for that working group, and then communicate, I believe from here, we would communicate with Samantha. She can create a list for that working group. And then if you need help facilitating the meetings, things like that, we can provide some support for that. And then as that working group is put together, we can start to agendize report outs on that working group.
And will we be able to request members from NGA or other people on our work group? Will we be able to ask you to help us add people to the work group?
We can have a conversation with them, absolutely.
Great.
Okay.
Yeah, I think that's also what they would like to see as well. Yeah.
Okay.
Thank
You've
you for
got
your
all that
support.
note. Okay. All right. Any other working groups needed to support the Technical Advisory Board? All right. Thank you. Next up is the Cal OES 988 report out. Here are some of the subjects that we're going to be covering today in the 988 report. We do have an update on the MOU, statewide 988 call handling and CRM status, as well as walking through how the surcharge is analyzed each year to support the budget. So first up, on the status of the SAMHSA Vibrant MOU. The MOU was signed by Cal OES. We submitted it back to SAMHSA with changes in the administration. They did come back with a few edits to support some technical functionality. We did have the engineering team and our 988 team review that, and then we've got that MOU with our legal team now, and it's under review with all of those edits. I spoke with our legal team on Tuesday about that, and I think we're pretty close to the final analysis. We'll brief our leadership and see what our next actions are on the MOU. We have had some very healthy and very successful conversations with SAMHSA and Vibrant as we have been working through and continuing to build the relationship and understanding on the way California intends on handling the 988 calls and the 988 workflow in California. And we'll get into that here on the next slide, which is an update on our state's platform. We have confirmed the platform has been installed at every center. It can support in-center workload as well as remote workload. NGA, who is the vendor providing the state's platform, has been going through and conducting training with all of the centers, and they have provided test numbers for the centers to conduct individual testing. Now, it is a test number. It's not actual live 988 calls at this time. Buckaloo out of Marin County has volunteered to be our first 988 center to pilot the state's platform. And we did get Vibrant and SAMHSA to support the pilot work. And we're targeting the first part of June to start bringing in actual 988 calls, live 988 calls on the state's platform for them to be able to answer. The pilot is scheduled for about a 2-week process, and that will give Buckaloo the opportunity to test the system, see how the system's going to support their workflow. We'll be able to provide direct feedback to the vendor and then analyze how we're getting those 988 calls from Vibrant into the state, and is that meeting all of our expectations, and then continue that conversation with SAMHSA and Vibrant as we continue to look at future centers to do these pilots. It is our intention to work through all of the 12 centers to do a pilot, to give everybody the opportunity to get in and test the system, give feedback. And I think based on that working group that we've just established, this will be a great opportunity for, I'm going to equate it to test driving a car. Everybody's going to get an opportunity. We're going to test drive the car, and I think it's valuable to have NGA involved in that conversation to get that that feedback direct, and then we'll have somebody from the Cal OES team to be there to help support and facilitate that dialogue to ensure we're getting everything that the state has asked for on that platform. I'll pause for any questions about the pilot project and where we are with the state's platform.
I just have a quick question. Will the state be reporting out the results of this pilot program, working with Buckaloo, and how it's, working through that process?
Yes. Yeah, we intend, we meet with the consortium on a regular basis. We intend on sharing that experience, what we're doing, so everybody understands. I think it's imperative that we level set our communication. As one center takes a step forward, we need to make sure that everybody's engaged in what's happening. I think that is kind of expected from every center. So the state will be facilitating a lot of that feedback, and then we're going to want, as Buckaloo goes live, we're going to want them to share their experience. It's easy for us to take the report and report it out, but now it's secondhand. And I think hearing it from those folks who actually tested the system, it's important that they share their experience.
I have a couple of questions from Space Health and the consortium. Is NGA in a renewal contract position right now? How long is their current contract going through? Because we're in this process right now.
Yeah, their current contract is through the end of this year.
December.
Yes.
December, okay. When we're doing all this testing and all of the feedback we're collecting, we received a document from Kurt to do some specific of the centers as we're going through. But if there is a point where this platform doesn't seem to meet our future, will we be looking at other vendors?
Absolutely.
Thank you.
That's a part of the feedback loop that we're asking all of the centers as well.
Okay.
Yeah.
Thank you.
We have opportunities in this contract for some configuration changes, some ways that they can support like adds and modifications to the platform. But we need that feedback to ensure that they're meeting the needs of the centers.
Does that include both the CHS and the CRM? Are they aligned to the same contract?
Yes.
Okay.
That's great news to hear, Paul. I'm just curious about a timeline, of like, because each of the center might be, some are more ready than others to be pilot and so on. So what's the timeline looks like to determine, okay, so by this time, all the centers should be ready to do pilot? How long is a pilot process is, and then when we determine, okay, this is it, now we're going to be live 100%. Is there a timeline like that? I'm curious.
And so the way I look at that timeline is this summer. We need about a 6-month window for contract execution or contract extension. So I think our timing, we've got some priorities that the team is working on, and we really want to get out there to these centers and get the system live so we can show that the system's ready to go.
Thanks.
Okay. Any other questions, comments from the board? Okay. Online? Okay, we have 2 comments from the public.
Hi, this is Sherry, again from DD Hirsch. I've actually had my hand up. I was going to comment when we were talking about the new work group, but I think it goes hand in hand with this conversation. I think that, Jeff asked what is the purpose of the work group if we already have a consortium, and we can kind of already talk amongst ourselves in that way. I think just to emphasize, at least my belief, I'm not speaking on behalf of the consortium, but I do believe that they have similar concerns. I think that, we're really looking for a way to have even more involvement in the processes that go along with the implementation of the unified platform. And we all recognize that this has been, an uphill battle for everyone, and everybody's, trying to make the best of a lot of variables that have been, put in the way in terms of getting this platform up and running. And it's taken much, much longer than anyone expected. But it is a real concern from several different perspectives. One is making sure that the platform actually has the ability to support our needs. And we've been through what feels like to us countless meetings where we've shared that information, and it often feels like it's not necessarily always heard or incorporated, or maybe we just don't have a closed loop on how it's being incorporated. And when, at least when I hear things like, there's an expectation that we might need to, go on a new platform in 6 months, given that I'm not feeling completely confident that there's a platform that's going to meet our needs. And then also thinking what that means to implement within a crisis system, a crisis call center where we're also trying to just focus on keeping the day-to-day operations going. There's a lot of planning that needs to take place to change a system, and we can't just turn on a dime. And so I think that for me, I'm really glad to hear that the idea of a work group has been accepted. And I really strongly hope that this is a place where we can close that loop so that, as we're providing feedback and giving these concerns, that, we know we're being heard and we're really working on this implementation in tandem, and as a group that, really is looking for a solution that can provide a better 988 system for the entire state. And, not something that feels like, it's sort of being put together piecemeal and might cause more challenges than solutions at the moment. So I really hope that the working group is a way for us to all be able to communicate more frequently and effectively about this.
Okay, thank you. And we have another comment online.
Yes, hello, thank you, Paul. Again, Matt Taylor from DD Hirsch. My comment is actually it's sort of separate from what Sherry just asked. But as I think we all know in this working group, the MOU negotiations between OES and the state and Vibrant and then SAMHSA have been going on for over a year now. And I want to, first of all, acknowledge and appreciate the efforts that the state has been making to try and clarify things with both Vibrant and SAMHSA. But at this moment, I would like to ask if you know, Paul, or if anybody else does there, what specifics issues are now still in negotiation? You said you guys have received a letter back and you're feeling like you guys are pretty close, but what are the current negotiations or sticking points between either OES or other state agencies and SAMHSA? It would be helpful because we just hear that there's ongoing negotiations, but don't know the specifics.
Just one second, Matt. I'm consulting with our counsel.
Nope, no problem. Thanks.
Okay. Matt, I would answer your question like this. The edits provided were minor. They were not significant edits, and they were technical in nature. We are working with our Cal OES team to evaluate that edit, and as soon as they're finalized, then we can further clarify the MOU.
And is it fair to say, though, that even if the platform is ready, meaning the NGA platform, or in the future, if there's some other platform, that 988 contacts won't be transferred into the OES platform until the MOU is finalized, or is there some workaround that you all have in mind?
So we've gotten SAMHSA and Vibrant to agree to deliver 98 calls to California for our pilot projects for each center. So we can test the platform, we can train our folks and ensure the platform meets our needs. It is for a short period of time. It is not forever bringing those 988 calls in until the MOU is signed.
And does that include chats and texts as well, Paul?
I believe it does include chats and text.
Okay, that's great news. Thank you for clarifying what you can. I appreciate that.
Any other comments online? Yes.
So for the testing periods that you're going to do in the different centers, what is the metric that you're looking to hit to call it a success, to be able to move on to another test period in another center? Is there like a specific list of technical requirements, like big things, little things, and then what kind of stuff, like, need, like, nice to have versus need to have kind of things are you going to take into consideration for the staff?
So our team has a test script that's been developed between the vendor and the team, and then we have requirements in the contract that we call it system sign-off, system acceptance, when the system's deployed, things that they have to meet in order to accept the system. So we're going to be testing on that, and then the user's experience. Can the system support the entire workflow for the 988 call? So we'll have an OES team as well as one of our engineers on site during the testing. So we OES can see and then hear direct from the center, and then interact with the vendor to ensure, if there's minor configurations or anything that needs to happen while we're going through this pilot, that work is being done.
And just a follow up to that, so if, just say you get all the centers, like there's 12 of them, so say 11 out of 12 are good to go, and then the 12th one you can't get over the finish line, what's the plan for that?
I haven't really thought about it in that context, but at that point, we would have to evaluate what's holding them back. And if 11 it functions and a 12th it doesn't, we have to really look at what is it operational need or technical need, and then evaluate how do we work with everybody to achieve success. Okay. So the next item on our 988 brief out is the 988 surcharge. As we all know, we're coming into the May revised budget process. This summer in June starts the SETNA fee rate analysis. And we've had this conversation a few times with the board. I just want to keep it front and center, just so everybody understands how this process works. So previously, the 988 surcharge was set at 8 cents. It was statutorily set at 23, or for fiscal year 23 and 24 at 8 cents. This year, it will start its full analysis phase. So starting in June, Cal OES will send a letter to all of the access line providers and start that data collection. The providers have through the month of July to send us their access line numbers. And when the governor's budget is approved and the 988 fund condition statement is made available, what we do is we have a formula that we take what is the budget authority, what is the budget carryover, how many access lines are there, and that tells us how much cash we need to bring in to support the budget. So the team will start that analysis. In August, we'll start drafting all of that information and work with our executive team. And then by October 1st, we have a statutory requirement to submit our analysis to the California Department of Taxation and Fee Administration, or CDTFA. So that work is starting, and then when the budget is approved in July for our August meeting, we'll be able to show the approved fund condition statement and start to walk through what the fee structure would look like projected for future year. And again, our budget is based on a fiscal year, July 1 to June 30, and our fee structure is based on a calendar year, January 1 to December 31. So I'll pause for any questions. Okay, any questions online?
Yeah, I have a question. This is Sherry again. I was just wondering if there was a plan, or if there could be a plan to work with the 988 centers to make sure that as you all are proposing what that surcharge rate might need to be, that you're really working hand in hand with us as we're doing our forecasting and staffing and budget requirement needs, so that it's informed by actual calls and chats and texts that are being received within the state, and the resources that are needed to support answering those.
So I think, so when we establish this fee, it is established based on the governor's budget and the authority provided to those who use SETNA funds. The state agencies who use the SETNA funds. So in order to set the rate, we have to see what budget authority we're given on the approved budget.
I'm not quite sure I understood that. Maybe you could say that in different words.
So I believe the question you're asking is, can we, as we establish this rate, are you asking that we take your budget needs into consideration? Did I understand your question correctly?
That's my question. Maybe I didn't understand your presentation correctly, but what I think I heard you say is that you guys are going into a period where you might be able to ask to increase the surcharge from 8 cents to a higher rate, or did I misunderstand that?
We can, however, the rate is based solely on the authority provided in the governor's budget to the state agencies.
Can you
Was that
provide
helpful,
more of
or-
what that means?
Okay, I'll take a crack at this. So,
Thank you.
and I'm looking at, because I'm not as familiar with the fee structure, but I can speak to the state budget. And I think edit me in real time, Paul, if necessary. But what I think I hear you saying is that we have the authority to adjust the fee structure, but it is based upon the appropriation level. The appropriation is set by the legislature. So right now, it may have been you, but somebody asked a question about the state budget and was there any resources being requested in the state budget? Any increase to this program would have been, that's proposed by the governor, would have been proposed yesterday, gone public yesterday. We are in that window of time of where we'll be having conversations with the legislature. And then the adopted budget that is voted on by the legislature and signed by the governor will set the appropriation for this program. Does that get to your question?
Kind of, maybe not exactly, but I see Narcissus has her
maybe
hands
let's
up.
do this. Ask me specifically, like, what is your wish? Like, what is it that you're trying to do?
I think our wish is that we're working in collaboration so that right now it's very challenging for us. We've got more demand on the system than we have resources to answer the contacts. And so I guess I just want to make sure that whoever it is that is looking at what is needed to support this system and potentially what surcharge rate might need to be set to do that is really working in unison with the centers. Right now, we're not at a staffing level where we all believe that we should be in order to answer our contacts, and you'll see that in our reports.
I think what might be helpful is to kind of bifurcate the fee and the appropriation. I think, correct me if I'm wrong, Dr. Bowie, that in your presentation, you're going to talk about a budget proposal. Would you concur?
No, I'm just reporting on what came out in the May revise yesterday.
Yes. So so Dr. Bowie, is there any sort of budget proposal related to 988 in the Health and Human Services area that was included in the May revision?
I have talking points about the May revise, so maybe.
Okay. So I think it's within that context that you would engage on kind of your interest in what's included in that budget proposal, but that will be the governor's proposal relative to 988 that will be discussed. The fee won't drive, the fee is on the back end and will just match whatever the appropriation is. So so I'm trying to, I think, help you in terms of the sequencing of when you want to engage. So don't engage so much on the fee side. You want to engage kind of on the front end on what a proposal might look like. Hopefully that's helpful. And if you need more, I'm happy to talk.
Thank you.
Okay.
Thank you.
Paul, if I could ask a question for clarification, this is narrowly constructed as to what this funding goes towards, right? So it's not like it can help the 988 centers with like salary or those kind of things.
The Miles Hall Lifeline Act actually has specific language for the three state partners, healthcare services, DHCS, DHHS, and Cal OES. The three state agencies have specific requirements in the legislation that they could use setting funding for to meet those.
But it's within the confines of the legislation says and what it can be spent for.
Yes.
Okay.
And also I would say, typically how we move forward with this, for Cal OES, the Setna funds go specifically to the technical aspect of this, right? And so that's
that
why,
that was what I was trying to get at is
Yes.
there are limits or constraints of what it can be
Yes.
funding.
So statutorily, it kind of defines how the funding can be used. But also for Cal OES, when we think about do we have sufficient budget authority to accomplish what we need to accomplish, it's within the context of that technical feature. And then on the Health and Human Services side, They're more about the program,
Right.
right? So we're
Yeah.
supporting the program. And so when they evaluate their own kind of the budget aspect, and if there's a budget proposal, it's to support the program side.
Great, thank you, appreciate that.
And I think that there probably not very clear definition or explanation about who actually drives or determines the surcharge. Because for a long time when we were having meeting as recent as just like a few months, well, actually as last November when we had one of the 90-day centers had meeting, and there was the author B98, the assembly member Cohen or something, and she basically explained that the legislature allow for surcharge up to 40 cents. And everybody was excited about it. Okay, well, so then that's great. Right now we only charge 8 cents. Why don't we go up more? So it implies that either KOES or whoever may have the authority to propose a surcharge. But with the explanation here, it sounds like it is the governor's appropriation budget that determine how much the surcharge is going to be. So it's not clear that way.
Yeah, the surcharge is based on the appropriation. The decision, the legislature actually controls the appropriation, and they will send a final budget that both houses vote on to the governor for his approval and signature. So now is that space and time where the legislature is having that discussion. Where the appropriation lands by June 30 is typically the date. That will be the basis for the fee. So then that will just be built into a formula that we use to develop the surcharge. Is that helpful? Yeah.
Yes, that's a lot more restricted than we thought that able to.
Well, I think it's important with any fee-supported operation, that nuance is lost. And so it's really important because when people want to engage and make sure that they're having a conversation, it's all about making sure you're engaging kind of at the right time. Because if you're coming to folks and you're trying to make a case for things, when do we need to adjust the fee? Is it by October?
October.
So, September is not the time to start having that conversation because the appropriation would have locked down in early July. So, yeah.
We have more comments online.
Hi, Nargis here from Crisis Support Services and the consortium. My question was when Paul was discussing kind of the assessment period regarding the fee, what are the things that are being assessed? What is that process like? Because that would be helpful to understand too, of which part of the process are you holding?
So I want to make sure I answer your question, Nargis. You're asking, how do we establish the fee?
Well, I think the person who was speaking before you said the fee established based on the appropriation. So I understand that, but you said there's about to be a process that begins.
Yes.
Yeah. So what is that process, and what is it measuring?
So every year, all of the access line providers, those telephone companies that provide dial tone that you can dial 988 and 911, they have to report how many of those access lines are available in the state of California. Previous years, it's been just over 46 million access lines. And it fluctuates up and down every year. People add phone lines, delete phone lines, things like that. So there's fluctuation. So the formula relies on how many access lines there are, how many customers are going to be available to pay this fee based on the governor's approved budget authority provided to support CETNA activities. And then the other variable is how much money do we have carried over from previous year. So based on that math, then we count how many access lines there are to determine where does the rate need to be set to collect enough money to meet that budget need.
I wonder if I'm going to say the same thing a little differently. and once again, it's always a scary thing when I'm, so Paul can correct me if needed. But another way, perhaps, to say this is what you should know. If I'm you, what I would care about, where's the discretion? So statutorily, in law, it defines what the revenue source, who pays into to the fee to be the revenue source for the fee, and that would be the lines,
The access line.
the access lines. So what happens is, we know that there is a fee being assessed against access lines, and the number of lines is a dynamic number, right? What is a fixed number is when the budget is finalized for the state of California, that is a dollar amount. We then know that we need to have fees sufficient to cover for that dollar amount. And so the process that Paul is describing is that you then go back to make a projection of how much revenue will be in the fund. If the revenue sufficiently covers the appropriation level, there's no fee increase. If we find that there's an appropriation increase, and when we count up all of the access lines, say there's been a reduction in access lines, so there's a difference between the appropriation and the amount of revenue that we would be getting based on the number of access lines, that fee increase is what makes up the difference. Is that helpful? That's the process that he's talking about.
Thank you. Yeah, that is helpful. So in order for us to really be able to be effective in saying, currently California is only answering 30% of text messages, the centers need more money, that conversation needs to happen at the appropriation level.
Yes, I would engage with your, the normal folks that you work with, early and often.
Thank you.
We had 2 other comments online.
I think it might be
Thank you,
me
Paul.
again. Oh, sorry.
you.
Go ahead, Matt. I wasn't sure.
Thank you, Paul. Sorry, I had to come off mute in video. I wanted to ask another further clarifying question about the potential AB 988 fee increase consideration relative to the May revised budget. So yesterday, the governor's May revised budget on page 35 notes that the 988 Suicide and Crisis Lifeline Centers, it says this: the May revision includes 17.5 million one-time 988 State Suicide and Behavioral Health Crisis Services Fund to support Suicide and Crisis Lifeline Center contact volume capacity. So that, does anyone know here, is that 17.5 million? Is that representing a possible increase of the fee, or is that 17.5 million a one-time sort of funding, I suppose, from AB 988 into this fund? Is it one time for some special expansion of service? So we don't understand what that means.
I think what I might, because that's on the program side, so that's why I hate to keep pointing to Dr. Bowie, but I think we're kind of going to defer to Dr. Bowie as the program person from HHS. And I think she mentioned that she was going to speak a bit to the May revision, and I don't think we've sorted through what that means on the fee side just yet. We're having those conversations.
Thanks. Yeah, it would be helpful to understand if that 17.5 is money that's going to OES for technology purposes, or to on the service side via
it would be the
HHS.
Service side. There is no proposal for Cal OES on the technology side.
Looks like Dr. Bowie might be ready to speak. I'm not sure if her hand's up or not.
Should I
Bowie?
go to that item?
I think we had one more comment, Dr. Bowie. Sherry, did you have another
Yeah,
comment?
I did. Yeah. Thank you so much for explaining this process. I guess I was conflating the surcharge and appropriations because I, in my mind, was thinking, well, if we don't have the money to do our services, we must need to increase the surcharge. And obviously, there's a lot more complicated factors that go into it than that. But it's been very helpful for you to explain that process. And I guess I just wanted to ask one more explaining question. If anybody can answer it, it might be Dr. Bowie, or I'm not sure who the woman is that keeps answering me because we can't really tell who you all are in the room. But maybe somebody has an answer. And I guess I still wonder, though, that it feels like to me, and I'm sorry that I just don't know the mechanisms in place within the state systems to understand this, but it still feels like to me that there should be some process where some state agency that's recommending a budget is consulting with us in terms of our needs. And so I guess if it's not Cal OES, is that an HHS function, a DCHS function, or where does that lie, or is there no such process?
We may not have the right people here. I don't have the benefit of having Dr. Bowie in the room, but on the Cal OES side, we're here to support the technical support. And so my assumption is that you're engaging the program side. We're really deferring to the Health and Human Services experts. So we're here to support the program, and we really kind of look to our Health and Human Services partners. But I don't have the benefit of Dr. B. I don't know how much detail you're prepared to go into today. But maybe there's something when she gives her presentation, she could be helpful on that.
Thank you so much.
Yeah, and I do know that there are folks, when I have talked to folks at the Health and Human Services Agency that are focused on 988. So I know that they're really thoughtful about this and thinking about this all the time.
Great.
Okay. Here is the graphic showing the math. These numbers are examples. These are not actuals based on current budget. So up at the top, we add in the budget authorized in the governor's budget. And then the next line down is there any carryover from previous year budget? And then that third line will tell us how much revenue we need to generate. So we go down to the number of estimated access lines. Here's reflecting 46.5 million. And through that calculation, 8 cents would be able to bring in $44 million of revenue, which would support the revenue needed for this example's future year budget. It's important to note that based on this estimated access line, each penny generates just over $5 million of annual budget. So when we adjust the rate, if we go up a penny, we're adding about just over $5 million into the revenue. So there's a lot of times that we don't collect exactly the amount of cash that we need. It's typically just over that collection. Any other questions from the board? Any questions from the public? And
Yes.
that's our...
Yes, one more question from the public.
Sure.
So since we're talking on the technology side, I do want to ask a question that the consortium has wrestled with a number of times and has asked. And that is that from the technology side, we know that the OES, the amount of money that the OES has to work with, a sizable chunk of that is allocated for the build and design of the platform, the unified platform, the OES platform, the NGA platform, because and revenues have already been received for some time for that from AB 988 funds. But what we understand as centers in the consortium from individual meetings with OES is that only a limited number of payments have been made thus far to NGA because the project is behind schedule and they haven't sort of fully delivered a viable product yet because of the vibrant MOU and because centers are also still, needing to test the product. So our question as a group of centers and as a consortium is for all of that money that hasn't been encumbered or spent out to NGA because of these delays, even though more money is coming in from AB 98, what is happening with all of those funds that are not spent that are allocated for technology? And is there any mechanism to possibly move them over to the program side to like DHCS so that some of those funds can be used to help further expand the 988 centers, which are underfunded and which are having increased volume needs, and we're being asked to answer more chats and texts.
I think the appropriation is set for, let me ask, the funding, so if there's program money, it comes through a Health and Human Services BCP, right?
That's correct.
And that money gets dispersed through whatever the budgetary mechanism is in those state agencies.
That's correct.
It does not flow through Cal OES. So I think you had several questions in there. I would say one thing, any funding in the fee that's not spent doesn't just poof go away. It rolls over in a balance, right? So there's that. The way to access the funding is through the appropriation process. So I know I've said that a few times, but if you wanted more money on the program side, then you would be working with the folks on the program side, and that would be through a budget appropriation specifically for the program.
Yeah, I understand. I appreciate that, Lisa, but I'm asking specifically about what about the funds on the technology side that I understand. It sounds like they're rolling from year to year to year, but presumably once a platform is up and running, the running cost of that, the ongoing cost of that would diminish over time because the bulk of it is on the
I see what you're saying.
Side.
So I think what you're saying is that on the technology side, if there was a decrease in the amount of spending because we're no longer in a ramp up phase, could that
or because the project is behind schedule
or whatever the issue is, could that longer term savings be made available for other purposes? It still depends on what the appropriation. The appropriation sets who the money goes to. So that's why I say I would really focus on the appropriation because that determines the path and the functions that the funding is set for. I'm happy to have an offline conversation also if that's helpful, but I keep bringing it back to the appropriation because we don't have the discretion. If there's money that was appropriated specifically for technology, it stays for that purpose. We don't have the discretion to move it for a different purpose for which it was appropriated. So the appropriation is key.
Mm-hmm. And is there public accounting for then how the technology costs are being utilized, particularly if they are not being if they're delayed in being spent?
I'm not sure I fully understand your question.
Well, do we as centers or members of the public know what is happening with the AB 988 fees that are set aside, that are generated for and set aside for technology costs? What if those technology costs are not as high? Are we knowing what is happening with those 988 related technology fees?
I think
because on the program side, we know we don't have enough money for all of the staffing and increasing volume.
I think the way to get to that is through the fund condition, but maybe at a future meeting, when we talk about the fund condition, we can speak a little more specifically about what's embedded in those numbers. Would that be helpful? This fund
that would, yeah.
This
you.
fund condition is what, the Department of Finance, the State Department of Finance is the control agency that kind of oversees the fund condition. And this ends up being a public document as part of the state budget. So there's a whole reconciliation. So maybe we could have just kind of not just a here's the numbers, but maybe here's how the numbers work and this is what's embedded in the numbers, if that's helpful.
Yes, I'm sure it would be. And again, these are also some of the reasons I think why the centers and the consortium have requested a specific working group to really dig into these understandings. So thanks for taking the question.
All right. Thank you. Any other questions online? Are we ready to move to the next item? Okay. Next item on the agenda is our California Health and Human Services update, and Dr. Bowie will be providing this update.
I'm sorry, did I miss the fund condition statement explanation? I've been having some internet connectivity issues.
Yeah, I had the fund condition statement up here on the screen. This is our current approved fund condition statement from fiscal year 24-25. So all of the numbers on the far right-hand side at the very top shows our beginning balance or the carryover from the previous funding year. And then as you work down, the next is the amount of revenue brought in from the fee. And then it shows the total resources, the amount of carryover plus the revenue generated by the fee. That total resources there of $57.4 million. That was at the beginning of the budget what we were starting with. And then you work down into the expenditure and expenditure adjustments. And these are the agencies that are using the Setna fund to support operations. In an important distinction that you'll see state operations and local assistance. There's two buckets in the Setna fund. State operations is what the state needs to operate the day-to-day. Our facilities, our personnel, our travel, our day-to-day state people costs. Local assistance is the money collected to support the local, our 988 centers, the deployment of technology, from the Cal OES perspective, the deployment of technology out in the centers. And then you'll see like the Department of Healthcare Services also has a state operations budget and a local assistance budget. And again, this was from the current 24-25 fiscal year. And then there's a fee collected by the California Department of Tax and Fee Administration to support all of the work necessary to collect the fee and administer the Setna fee. And then when you do all of that math, it comes out to the total expenditures and adjustments. So last year was projected we needed $43.7 million for the budget. And then we have an estimated $13 million of carryover into this next fiscal year. Dr. Bowie, does that answer any questions that you had on the fund condition statement?
Thank you so much. That's helpful.
All right. Thank you.
All right, I don't have slides, but I can just go quickly because I heard a number of questions about the May revise, which just came out yesterday. So much of the work that we have been doing in the last several months has been to work closely with OES, DHCS, 98 centers, and other implementation partners on AB 98 implementation activities. Cal HHS role for the state is really on coordinating our state and local partners in really this very complex process with a longer, so our immediate goal has always been to support and fund the 98 centers to provide the services that they provide on an everyday basis, the critical essential crisis services. And then we've got this longer goal of eventually integrating 988 into the crisis care continuum in a way that aligns with overall behavioral health transformation efforts in the state, because 988 would only work if it's part of an integrated system of care that provides therapeutic care to individuals in need when they need it, wherever they may be in the state. The May revise just came out yesterday, so we're still processing. But what I can say at this point is that despite a tough budget year, the May revise still provided additional funding on top of what was already appropriated on an annual basis. This is with the goal of helping 9/8 centers to provide 9/8 services, recognizing that there has been incredible rising demand and lots of needs that we need to answer. So what we were able to secure was, on top of what you saw in the previous slide on the fund condition, the finance has appropriated on an annual basis $12.5 million for local assistance to DHCS. What local assistance means that all the money goes to the 9/8 centers to provide 9/8 services. That's an addition. So the additional May revise is additional 17.5 million on top of that 12.5 million. So for fiscal year 25-26, there will be a total of 30 million if the budget was approved and signed. So 30 million specifically for local assistance, specifically for staffing of 9/8 centers. I hope that's clear.
Did we lose you, Dr. Bowie?
I'm still here. I stopped talking. Are you able to hear me?
Yes.
That is all my update.
Okay, thank you. It looks like any questions or comments from the board? Any questions or comments from the public?
I'm just curious, Dr. Bowie, so with the additional funding or tentatively additional funding, do you have an idea of when the DHCS will be able to inform the 9/8 centers about the allocations and so on, so that they can do planning for staffing or any other operation-related activities for the next fiscal year?
I don't know what the timeline is. I'm sorry. We are still trying to align and touch base. So I think I'm going to defer it to DHCS. I don't know what's been the yearly process. I would imagine it's as soon as allowed.
Yeah, it's kind of it's not a complaint, but at a county level, like county operations, we have to submit our budget proposal to the board between March and April for approval. But a lot of the operational activities and funding allocation, we won't know until like mid-June. So a lot of what we propose is just estimate, to say the least.
What I might offer is, and Dr. Bowie, you can edit me also as needed, but what I might offer is that this is a Health and Human Services Agency proposal, DHCS. This is just the beginning of the conversation. I'm sure that they're going to be engaged in that, and then they'll probably be able to provide you the kind of information that you need, because we recognize if you're not given ample time to plan, then it kind of diminishes the impact of any funding, right? So I think this was something that we were really pleased to hear about. So it's a good development in the budget, but I think it's the beginning of the ongoing conversations with them as they operationalize, with our fingers crossed that we'll be successful in getting legislative support.
I think we had online comment.
Hi, thank you. I just wanted to, it sounds like there's still some details that will need to be worked out, but this is potentially very great news to hear. And really want to just, thank you, Dr. Bowie, and anyone else who's been involved in the advocacy for this potential increase. And as Lon mentioned, there are a lot of things then that we have to do to actually make that spending happen and make it result in more people getting their contacts answered. So planning is important, but I just wanted to underscore that it is really good news to hear that. And we are very appreciative of the work that's been done to support the centers.
All right, thank you. And we have one more comment online.
Yes, Matt Taylor. I'm just echoing that appreciation. We know that Cal HHS and by extension also DHCS have been trying very hard to understand centers' cost needs and looking for ways to increase funding. We do know that there is a strong desire by all the 988 centers as well as the state agencies to increase the number of chats and texts that are answered, and that is on top of the significant 988 call volume, which is increasing. So these kind of recommendations for funding increases on the program side are well timed and very much appreciated. I know there's still yardage yet to be gained before a budget is approved, but even hearing this is like Sherry said, good news and appreciated. And we do just, of course, also like in DD Hirsch's side, we echo Lon's comments that as soon as we can know what our state fiscal year 25-26 budgets are, it would be very helpful, because the staffing ramp ups that occur when we get these new budget requests, the staffing ramp ups can take up to 6 months. And we're less than a month and a half away from the beginning of the new state fiscal year, and we don't know what our budgets are yet. Thank you.
All right, thank you. No other comments from the public? All right. Moving to our next agenda item, this is our SAMHSA FCC and Vibrant update. As I stated earlier, the team has really been working very hard with SAMHSA and Vibrant to really facilitate our pilot project. That's been our main focus. All of the work that we've been doing, that's been our primary conversation. We haven't expanded any other conversations at this point. We're really just trying to get this MOU pulled across the finish line and get 988 contacts delivered to the state of California. And as that continues to develop, we'll keep the board updated. Any questions on agenda topic 7? Any comments from the public? So our next item is the 988 funding policy, and the team has really been working hard to develop a funding policy that really mirrors the funding policy that we support 988 centers with. And as we were really close, we started talking to centers and started hearing about other needs that the centers have, and really taking a look at the 988 workflow is not as simple as a 911 call. A 911 call comes in, the dispatcher takes that information. When that call is ended, the 988 call stops. There's some transfer of information from the dispatcher to the first responder, but that 911 contact is concluded. And we recognize that that's not necessarily the case in the 988 workflow. So over the last couple of months, we've gotten a lot of really good feedback from the centers, and the team is coming back to really evaluate how we can evolve a funding policy to be able to support that entire 988 continuum of care. So we've got some drafts put together. We have a few different data models that we'll be presenting to our leadership for concurrence. And it was our hope to be able to come with a functional draft at this meeting. But with all of the additional information that we've heard and some real digging in that the team has done, I really want to be responsible and make sure that we've got support from our state partners and support from our leadership on this funding policy. So it's our intent at the August meeting to be able to present a nice functional draft to the technical advisory board. I'll pause for any questions from the board members. Any comments from the public? All right. Item 9 is the 911-988 transfer guidance document. And as Mr. Hebert had presented from his working group, we facilitated a meeting with the transfer guidance working group, and the team received a presentation from San Ramon Valley Fire, and it really gave a lot more detail and clarity on how we can support this transfer policy. So Mr. Hebert and the team have gone back to take some of the feedback provided by San Ramon Fire, and they're evolving that document. We're going to host another open meeting here in late June or early July, and then really take a look at how do we frame this document to be like a version 1 first step to a 911-988 transfer policy and present that in the August meeting. And then from there, as we work through and centers start working with their local 911 centers and develop these transfer agreements, the team can start to collect that data and continue to report out on the success. And I really point to the way San Ramon has developed their policy. I think what they're doing down there is very successful, and it works for them. And how can we take that and start to model opportunities for other people to take that theory and develop what works for them locally? Jeff, would you add anything else to that? All right. Yes, Lon.
Yeah, thank you for all the work that our chair, Jeff, has been doing for the work group, and being an active member of this work group. I see that our document has been continuously updated and changed for the last, since it started like a year and a half or 2 years ago. So I was hoping that we were ready for the board to approve or to vote on this meeting, but it seemed like there'll be additional update that we need to do on the documents. I just want to clarify that even after the board approve on the document that we present in August, there'll be probably future integration and updated. So regardless whether the board vote today or August and so on, it's like an ongoing document, it seems like. So that when we are final, and because of that, even though if the document has not been voted or approved yet, members of centers still can use that as a recommendation to develop their own procedures and so on. And that work for their local jurisdictions. Correct me if I'm wrong.
No, you're right, Lon. And as you recall, or you may recall from the working group meeting we had, that was part of the discussion that was had, was there are a lot of jurisdictions and areas that are craving some guidance. They want to do something right now, and I would actually not discourage them from moving forward to meet their individual areas' needs. I think the thing that's kind of changed some of the direction for what the working group's been talking about, the publication of the NENA standards document, it does contain some very insightful items that it suggests being addressed that we had never talked about. So that's part of that. And then also knowing that, like you said, things are going to change. Like right now, if a PSAP wants to transfer to a 988 center, they can't just say transfer to 988. That's not going to work for them. So the document's going to have to address that and how those relationships are built between the 988 centers and the PSAPs in the areas that they serve. What number do they want that transferred on? Because we don't want ideally it should be a separate number that bypasses any type of normal screening mechanism, things like that, things that we haven't, our working group hasn't had an opportunity to talk about. So that's why I think it is important that we don't move forward unless the board thinks otherwise, to move forward with voting on what the existing document is. But I do think that come August, we should have something that the board could vote on knowing that we are going to have to make adjustments along the way as the technology changes and other things continue to be set in place.
All right. Any other questions?
Is the existing document available on the website? Okay.
It's on the Cal OES 988 website. If the same location where this agenda for this meeting is, and I would encourage, for those who haven't had an opportunity to read through it, to be able to provide that feedback, and then also encourage people to seek out do we have the NINA document on that page as well, or a link to it?
We'll get it up.
I think that would be helpful because I like I said, I found it instructive in taking into consideration some things that we had never talked about in our working group. So if we could get that up there, that would be helpful.
Yeah. Yeah, we've got a note. We'll have the standards document. We'll put it on that same page. Any other questions or comments from the board? Any comments from the public? Okay. Item 10 is agenda topics for future meetings, and then our future meeting dates are posted here. August 21st and November 20th of this year are the two remaining dates. By the August meeting, our board liaison, Samantha, we will have the tentative 2026 dates drafted up, and we'll present those to the board, and then we'll send out calendar placeholders for the 2026 calendar year. Are there any agenda topics for future meetings? Okay.
I think maybe an update on the new working group for 988. Yeah.
Yes. Yeah, we do have that as a note for the working group
okay,
section.
great. Yeah.
Yep.
Thank you.
My only comment is August is often when a lot of people are out, and since we have the mandate to have at least 8 people in this room, that we just do a little bit extra coordination to make sure we will have an active meeting so we don't run into having to miss that meeting and having only one more for the year.
Yep. Thank you for the reminder. Okay, our next item is public comment. Do we have any public comment for items not on this agenda? Okay, no public comment. Next is adjourn. Thank you very much. I appreciate everybody attending today. Thank you for those attending online.
Thanks, everybody.